What's up, everyone? What's it like being a physical therapist at Optimum Performance Sports? Let's go find out.
Yeah, so my name is Tyler Littlejohn, or also known as LJ. So I've been a physical therapist for the past 2 years now, out in Warsaw location as well as in the Jefferson location. Trying to kickstart the sports program. So I've been, I've had a fortunate opportunity to serve the community of Warsaw. Seeing a lot of athletes out there from anywhere from shoulder injuries all the way to knee injuries, even ankle sprains, to even the older population as well, and a lot of orthopedic cases too. So like a lot of total joint replacements.
Okay, nice. So what does a typical day look like in your current role, and what other professionals or departments do you collaborate with?
So a typical day, I could see anywhere from 10 to 14 patients in a day. Here at OPS or OPT, we see patients for 45 minutes, and it's all one-on-one care. So it's just one clinician, one patient, seeing them and just serving them and giving them our full, complete, undivided attention. And again, we see anywhere from patients that have had total joint replacements, whether it be total shoulders, reverse shoulders, rotator cuff repairs, knee replacements, hip replacements, and then even the pediatric to athlete population as well. And then other professions that we work with, we work hand in hand with the surgeons. So we're constantly sending them progress reports or updated plans of care, just in regard to the patient that we're mutually treating, just so that we can both be on the same page while we work with them and rehab them. But then we also work with the athletic trainers in the community as well. If there's any athletes that are coming to see us, just trying to get a baseline for what sports they're coming from, how they were moving before, and since they see them more frequently than we do, since they're there every day at the school with those athletes, just keeping a good positive rapport with them, just so that we can make sure that we cater to the athletes the best we can.
Perfect. Yep. And to end this, what message or advice would you like to offer students or future professionals who are considering a career in physical therapy, or like the future generation in general?
Gotcha. Just find ways to, just be an extension of, healing hands. Find ways to, be yourself and, just be creative. I feel like it's easy to get out of grad school, get into a clinic and conform to the ways of that clinic, but find ways that will, help you stand out in a positive way. Not to, take away from what everybody else is doing, but, just to help with one, patient buy-in, but then also, utilize the platform and the opportunity that you have to build close connections with those patients, and then also offer good healing as well, just to get them back to their lives and just see them where they're at as well. I feel like oftentimes, there's a relationship gap with the patients that come in. So just taking the time to treat them, see them, for the people that they are, rather than for their diagnosis, and then just getting on the same page as them. Just having a very empathetic approach, and just connecting with them.
All right, sounds good. Perfect. All right, and last thing, would it be possible for us to take a brief tour of the facility to better understand your work environment?
Of course, man. Let's go do it.
Sounds good. How long has OPS been around for?
OPS has been around for about 10 plus years now, and it's been growing and expanding. So we have locations, multiple locations in the Fort Wayne area. We have a location on DuPont, down in the Jefferson area. We have here the location in Auburn, as well as a location down in Warsaw too. And there's also a location downtown Fort Wayne too. So here we got our stairs. So stairs are a functional movement that we use, whether at home, in the community, or even going up and down stairs. Even going up and down curbs in the community.
Yep.
So here we like to try to address that pivotal functional movement, and just make sure that ascending and descending looks good, looks normal, and that there's no asymmetries or any imbalances. So one piece of equipment that we have here, we got the leg press machine, one that you probably often see in many different gyms. We like to use this just to help focus on lower limb strengthening. We can go double leg, single leg, to help alleviate any asymmetries between the limbs. So that's a good way to kind of help overload the lower body as well. And also take some pressure off of them. Rather than doing a full body weight squat, sometimes we can try to get them in a gravity eliminated position and do lower leg strengthening that way. Here we have our cardio equipment. Here is the new step. Oftentimes we, anybody that comes in with shoulder pain or a shoulder surgery, we like to kind of help use this equipment to warm those shoulders up before we get the therapy session started. But we can also use this for our low back patients, as it's low impact for our older population. Again, just to kind of help get them warmed up and started for the therapy session.
Hello everyone, thanks again for watching today. Shout out to LJ for letting me interview him, and shout out to Optimal Performance Sports for letting us get a tour of the facility. And tune in for more videos like this, and down below in the captions we'll have his Instagram handle as well as the facilities. Thank you for watching, and I'll see you tomorrow.